No. Or quickly we'll spend a minute or two, try to recollect all the key points, and then I'll start with a new remedy. What are the key points in Ladam? Yeah. Okay. Yeah, one at a time. It's a very good remedy for joint affections. Yes. Yeah, it's also a remedy for gout. Gout with epistaxis. Yes, gout with cataract, good. And what is associated with epistaxis? Rheumatism alternates with epistaxis or hemoptysis? Hemoptysis. Okay, good. Then what else? Yeah, it's a very good remedy to prevent tetanus. Injuries punctured. Yes. Yeah, diagonal affections. Yeah, it's a very good remedy for bites. Poisonous animals. We gave examples of snake. Yes. Emaciation of the affected part. Good. Ascending rheumatism. Beautiful. Discoloration remains long. Good. It's all there. Ptosis. Ptosis after? Beautiful. Ptosis after injury. Yeah. After iridectomy, there will be hemorrhage in? Beautiful. Anterior chamber. What else? Acne? Acne, what was its speciality in Ladam? Aito. Yeah. In brandy drinkers. Okay, good. Anything else? Hardness of hearing? After haircut. Good. Unbearable pains? Okay, you are talking of type of pains. Good, okay. Then what else? Yeah, we are done with it. Okay, chalo, I am happy. You could reproduce a lot of things. We'll start a new remedy. Okay. Before I start the new remedy, now what do you understand from this particular image? Yeah, he's a physician. Yeah, he's a surgeon. Fine. It's a surgery OT, it's a surgeon get up. Surgeon, fine. See, the idea of showing you this particular image is, there is one remedy in our homeopathy, and this remedy is called as surgeon's knife or homeopathic surgeon. Okay? So, which is that remedy is what you all will tell me. Okay? The remedy is? Beautiful. The remedy is SILICEA. But my question is, why SILICEA is called surgeon's knife? It prevents surgery. Okay, so what you have to understand is, you know that SILICEA is a remedy which is called as surgeon's knife. Probably at the end of the class we will try to understand why SILICEA is called surgeon's knife. Okay, am I clear? Okay, so the remedy, as you rightly told, is SILICEA, and SILICEA is a remedy which is predominantly seen in nature, and in nature it is seen as sand, it is seen in the rock beds, it is seen in the river shores. Okay, and again the credit for proving SILICEA goes to, see, when you don't know, you tell Dr. Hanuman. Fine. The credit for proving SILICEA goes to Dr. Hanuman. Now why I am insisting is, SILICEA in its natural form, it is inert. Allah. Only after you potentize, you get to know the real effects of SILICEA. SILICEA is not only present in nature. Small quantities you see SILICEA even in our body. Okay. Which part of our body we see SILICEA? Which part of our body we need SILICEA? Or in which part of our body we have SILICEA? We have SILICEA in? We have SILICEA in? Which part of our body? From your physiology knowledge. Where is SILICEA present? Very good, it is present in bones. Only bones. It is present in hair. it is present in the connective tissues, it is present in the body fluid. See, now if you understand where SILICEA is present, why this knowledge is important for us? Very good, very good. If you understand where SILICEA is present, when you prove or when you understand SILICEA, you will know which part of the body SILICEA will have an affinity. So indirectly, I am giving you a clue which part SILICEA acts. That is what we call it as sphere of action. Okay? And this knowledge also will help you when you read SILICEA as a biochemic salt. See, SILICEA you have biochemic, and SILICEA you also have homeopathy. They are two different entities. And SILICEA as a biochemic is used for what? It is used as a supplement. It is used to take care of the deficiency part. But when you read SILICEA as a homeopathic remedy, you will understand something beyond. You will understand things beyond deficiency. Okay? So we will slowly try to explore. And as discussed in the last class, it's a beautiful remedy. But we don't have so much of time to spend for SILICEA. So we'll try to, cut short whatever is, I don't use the word not required, because every information in SILICEA can help you somewhere. But I'll try to limit this class keeping you second years in mind. Okay? So that we'll save little time. Okay? So as I was just trying to tell you, he is the great person who proved and showed the world that this inert substance can have beautiful medicinal actions. Okay? Moving further, and I am just trying to tell you about the preparation part, trituration. I will not talk more about this. For me, more important, as I was insisting, is the sphere of action. Okay? So SILICEA, SiO2 is the chemical formula, and it is prepared by trituration. It's a deep acting remedy, constitutional polycrest remedy. And I told you where in our body this is present, and we will try to understand where the sphere of action, where exactly SILICEA acts. Okay? Now what you see here is, this is a remedy which has predominant action on the CNS, nervous system. We spoke of other remedies. Yadu? Dulcamara, Sina, Dulcamara and Sina. Now you see that this remedy acting on the nerves, acting on the CNS, it will cause neurasthenia. What is this? Neurasthenia, or we call this as nervous debility or nervous weakness. So it acts on the nerves and it will cause a nervous debility, nervous weakness. You are following? You saw Dulcamara, you saw Sina. The action was different. You are trying to understand SILICEA. And SILICEA acting on the CNS, it will cause nervous weakness or nervous debility. Neurasthenia, very important. Okay. Now, second very important thing, is its action on the. Now, before that, we missed something here. This was the nerves, and the second thing is the GIT. And again, if you look, I am trying to concentrate mainly on the lower bowel. You are getting from the image? This is a remedy. See, I told you it's a polycrest remedy. What is a polycrest? Which has got wide action. A remedy which can act from your head to toe is a polycrest remedy. So it acts everywhere. But the special affinity is for the lower bowels or the lower intestines, the rectum. Acting on the rectum, SILICEA causes constipation, fissure, fistula. I'll explain. For time being, it acts on intestines, the lower intestines, and it will cause constipation, it can cause fissure, and it can also cause fistula. Okay? We'll go more in detail a little while after some time. Now, on skin, this again a very important action of SILICEA. Yen madatte SILICEA? Acting on skin, it will cause eruptions, and more than eruptions, When you ask me what type of eruptions, SILICEA will mainly cause pustular eruptions. You have something else to tell? No, I mean pustular eruptions. This is very, very important. Okay? And this is where, or this is what is very, very prominent in SILICEA. We'll be taking up that under characteristic symptoms. Tendency to form pus. You keep this point, very important point. Little injuries in SILICEA, they suppurate. Small injuries, they suppurate. We'll discuss more. I asked you a question. Why SILICEA is called homeopathic surgeon or surgeon's knife? This point will help you in answering that particular query. So tendency to form pus, pustular eruptions, ulcers, cracks is all what you see under skin. Okay? See, not only skin, probably this is what I was just trying to tell you, that it causes more of pustular eruptions. Okay? Whitlow, Fallon. Okay? And probably this is the cracks that I wanted to tell you. And little injury suppurates, pustular eruptions, and this image tells us that SILICEA is also a very important remedy for ulcers. Ulcers. Okay? And see, another very important area. We are seriously trying to reason out materia medica. Now, when we talk more about SILICEA, you will see that SILICEA will have bad discharges. You know, SILICEA will have offensive discharges, especially the sweat. Okay? Especially the sweat in SILICEA is highly offensive. If that particular fellow removes his socks, you can't stay there. Okay? You can't stay there. So highly offensive foot sweat. Anywhere. But SILICEA, foot sweat is highly, highly offensive. Now why is this offensivity in SILICEA? That's because of its action on the lymphatics. Acridity. I'll tell you when I talk more about SILICEA, SILICEA discharges in SILICEA are so acrid that the sweat will eat away socks. You are getting my point? The sweat will eat away the socks. That, what does this tell you? Is all your socks are eaten away by your sweat? No, no. So now you try to understand why in SILICEA the socks is being eaten away. Now this eating away of socks is mainly because of the acrid discharges. Acrid discharges. We saw few more remedies having acrid discharges. Which were those remedies? Huh? Yeah, very good. Ailments. But Ailments patient, will the socks be eaten away? What is eaten away in Ailments? Correct? Huh? The mush. The mush. Fine? Okay? Upper lip. See, in women, the upper lip will be corroded. Okay? In men, the hair is eaten off. Eaten off means that's the amount of acridity you see. So in Ailments it is the mush. In SILICEA, the acrid sweat, especially in the foot, which will eat away the socks. Okay? So acrid and offensive discharges is what you have in SILICEA, acting on the lymphatics. And it can also act on the lymph glands, and it will cause enlargement. Okay? Lymphadenopathy. The lymph glands are enlarged. And in SILICEA, do remember, this will not stop at the level of enlargement. It will go to the level of suppuration. Okay? Glands can also be suppurated. Small injuries can be suppurated. Okay? So when a patient comes to you at this stage, when things are going into suppuration, the remedy you think of is SILICEA. SILICEA. Any questions? See, concentrate. These are all polycrest remedies, very important remedies, and you should know. You should know. Okay. And say I was also trying to tell you about the glands, the glandular affinity. Okay. So, like for example, you see in the drug picture, this is a remedy which will have a lot of affinity for glands. Okay. So glands enlarged and glands glands enlarge and glands can also go into suppuration. Axillary lymph nodes, those nodes are enlarged and you see pus coming from those lymph nodes. There are many remedies, but one remedy as a second year student you need to remember is SILICEA. Okay? I'll just share a small case. We have one very good orthopedic friend of ours, okay? And he is a man who believes in homeopathy, he takes homeopathy, and many times, he refers cases to me. There was this guy from Kashmir who had consulted him. He had undergone 3-4 surgeries in Srinagar, and from tibia there was this pus oozing. And he came to Bangalore, and luckily he met this particular doctor, and that doctor saw this case and he told already some 2-3 surgeries were done. And then he called me, Vijay, can you do something? Sir, no problem, sir, we just send. We homeopaths will never say no to anything. Fine, you say, what we diplomatically say is you send. If possible, we'll take it. If it is not possible, it's fine. 3 surgeries, all 3 surgeries are a flop, and it continues to ooze. This condition is what we call it as osteomyelitis. Okay? Osteomyelitis. The bone marrow, this soft tissue in the bone, all that will be infected, and you have this acrid, offensive oozing coming from the bone. Osteomyelitis. And this orthopedic surgeon was so impressed with our treatment, and after 3 months, this guy who came back from Kashmir, Srinagar, and he consulted him first. And we make it a point, they consult them first. Why? They'll also know what homeopathy can do. These surgeries didn't do anything. Okay, so I told him, when he called, you first meet that doctor and then you get back to me. And the doctor was surprised to see the results. Oozing has stopped and beautifully healed. We have the photos, and if you see before treatment, after treatment, is it the same leg? Is it the same person? Is it the same bone? And the remedy I had given there was this SILICEA, not this. Don't be confused. I'm not talking about the remedy, but what I want you to understand here is SILICEA is such a deep acting remedy, and it has a capacity to act on bones, and it can cause caries of bones. Okay? It causes caries of bones. Fine? It causes destruction of bone. It causes decay of bone. Fine? And this is the condition, what we call it as osteomyelitis. That Kashmir guy, he was given the same remedy, SILICEA. Okay? With beautiful results. So osteomyelitis, do remember. Not simple inflammation. See, if you come to 3rd year, you will be introduced to miasms. And if you start teaching materia medica through miasms, it is more interesting. But nevertheless, do remember that SILICEA is a remedy which acts on bones, and it can cause ulcers, it can cause caries of bones. That deep is its action. Okay? And when you give, it beautifully works. When it is indicated, it beautifully works. There are a lot of other remedies which acts on bones, but I want you to remember this remedy to the extent of causing caries. A lot of other remedies, fluoric acid. You also have calcarea phos. Yeah, good. You spoke of calcarea phos. See, calcarea phos is not that deep. Calcarea phos max. What will calcarea phos do? Calcarea phos max can help in improving osteophytes, callus formation. Okay, but to the extent of caries, calcarea phos is not that deep. Calcarea fluor can be a remedy when you have all those ulcers. Fluoric acid, Merksol. Okay, these are all remedies which have calibic. These are all remedies which can be deep enough. Calibic again more of skin, but when you talk of bones, they are more of Merk, they are more of fluoric acid. Okay, which can cause that deep action. Okay, any questions at this stage? What did you understand? SILICEA? Naturally it is inert. In nature it is inert. When you potentize, that medicinal properties are liberated. And I told you where exactly you have SILICEA in your body. And we are also trying to understand the sphere of action. Very important. The first area is CNS melano. Neurasthenia, beautiful. That's the word. Second is GIT, especially the lower intestines. Constipation, fissure, fistula. Good. Third, skin. Okay, good. Then we spoke of its action on bones. Yeah, lymphatic system. Acrid, offensive discharges. Very important. Okay. Moving ahead, I told you about its action on the intestines. You see this gentleman with constipation. This is what we call it as fissure. I'll explain. And you also have opening. Another unnatural opening. What we call it as fistula. Okay. So you see fistula, you can also have fissure, or it can be constipation in SILICEA. Okay. Any questions? Okay. Anyway, we'll discuss again. Now on the urinary system, you can see a lot of pus cells in the urine. Okay, a lot of pus cells in the urine. It can cause inflammation. See, recently, we had a case of a gentleman, 58, 60 years old gentleman who had 11 mm stone, 11 mm stone, which was stuck in the ureter, and he had bad pain in the night, and that's when he went to an emergency ward in a close by nursing home. They got a scan done, and that scan showed left ureteric 11 mm stone, and he was told, you need to undergo surgery. Fine. I mean, they blast. Lithotripsy is the procedure. So, but this guy is a staunch follower of homeopathy, and that evening he came back to me, sir, this is the situation. Can you do something, or should I go to lithotripsy? Fine. So we have the scan reports. 26th May is when he came to me, and 26th June we have done the scan, and that scan shows no stone, 11 mm. He has stones 4 mm, 5 mm in the kidney. He still has. Okay. Now what should be your burning problem? Should the stones go here, or should the stone go here? And the scan says the stone is huge, and there is backflow of urine, and it is putting pressure to the left kidney, and the doctor there told your kidneys will go into failure. See, there's all back pressure happening, and immediately you will have to undergo surgery. Okay? Fine? So when they come to you, relax, use your common sense, take the case properly, see why stone here, what is the problem, analyze, treat. Okay? The wife was asking 3 times, sir, has it really gone? Fine. Where has it gone? 11 mm, no? Where has it gone? Has it really gone? You think the sonologist is a mad guy, or is my friend? Boss, I am sending you this patient. Give me a report telling there are no stones. Fine. She's gone to the same sonologist, and we make it a point to send them to the same sonologist. We also make it a point to tell the patient, tell them you are taking homeopathy. Why? They should be aware, no? What our dynamic sweet pills, what magic they can do. See, there are good sonologists also. I had a lady, sonologist, who had called, and she was surprised. Doctor, your patient, she had fibroid, and when compared to last report, it is much, much better. What are you giving? What are you doing? You're getting my point. At least they get a little awareness that, that there is also a system called homeopathy, and what we do with surgery, these guys can do without surgery. We do have our own limitations. Okay? But this is one case that gave me a lot of happiness. I'll give you the reports. If you are also suspicious like his wife, really, it went. So if at all you have such doubts, you can always come back. I'll show you the reports. I didn't plan of talking of that case here, but then this tempted me, this kidney ureter, that image tempted me to share this small case. 11 mm, fine, 11 mm, beautifully dissolved, and no ureteric block. That left kidney which was under pressure, bulkiest, okay, hydronephrosis and all, that's absolutely normal. Okay, we'll get back. Huh? What is it? See, question should be loud and clear. Oh, yeah. Yes. Yes. It will go. See, now, that's the reason I asked you, what is the priority? Which one should go first? That will also go, not that it will not go. But it is somewhere in safe position. Sudhana. See, you got your friend's question. See, why, sir, stones are still there in the kidneys? Those stones are there, 3-4 stones are there, it will go. By next report, it will go, don't worry. But my concern here, what I was trying you, or what I was making it a point for you second years to understand is, which is more important? Should this go or should this go? Only if this goes, this will also come down, no? Yella ban serkombitre, and they'll cause more blockage. So the priority, the burning thing is this. This should dissolve. Those things also will dissolve. But which one should go first is also very important. Only if this clears, urine flow will happen, no? So nature knows, your body knows which one should go first. Okay? If this has gone, and if this is there, and kidneys are getting damaged, that's not good. That's a bad sign. Are you with me or finding it difficult? Yes. Okay, fine. So, kidney stones, not kidney, like ureteric calculi, 11 mm. Generally, looking into the anatomy, fine, the ureter diameter and all, many times we homeopaths don't touch. We send them back. No, jao. Humko bhi neend se, we also want to have a peaceful sleep, go. But then, before saying no, try to take up the case, see what best you can do. Okay? The remedy I gave was a different remedy. I will not talk that remedy for you right now. That's not there in your syllabus. That remedy, see, if I tell you the remedy, what will happen? It does not mean that, tomorrow you get a person with kidney stones or ureteric stones, you give that remedy. That remedy was given as a constitutional remedy. Okay, and that remedy was Baratakar. Third year, we have Barata, beautiful remedy. And probably Subhashini can also ask me what happened to the other stones, how many doses you gave Barataka, why you gave Barataka, I can explain you much better. Okay, so next year do ask me this question. Fine, okay. So on the female, okay, and on the male genitalia, what you generally see is this remedy causes increased sexual desire. This remedy causes increased sexual desire. Okay. Now the next topic, sphere of action, is this clear? See, if you have understood sphere of action, 50% of my job will be done. Okay? If you are stuck with sphere of action, then things will become very difficult. All of you are clear? Huduguru? Then we'll move ahead. Ailments from, again a very important topic. In SILICEA, what are all the causative factors? Okay? We have discussed somewhere, we would have told you, one important cause in SILICEA is vaccination. Ailments from vaccination. Okay? We have got plenty of remedies in Materia Medica, in homeopathy. SILICEA, Tuja, they top the list. Ailments from vaccination. Good. And not only vaccination, ailments from or ailments in stone cutters. You see the image? Chest pain in stone cutters. Conversions from vaccination. Okay? And what is this? Ailments from loss of fluids. Okay? You see fluids, IV fluids. Ailments from loss of fluids. And ailments from mental exertion, mental stress, overworked, overpressured. Fine? Okay? And ailments from strain, injuries. When do you think of SILICEA in injuries? At the stage of, or when they come to you in the stage of suppuration. You getting my point? Ledum also was a remedy for injuries. Allah. Arnica is also a remedy for injury. SILICEA is also a remedy for injury. And when do you students have confusion? When we tell ledum is a remedy for injury, calendula, arnica, SILICEA, then you get confused. But now it is very clear, no? Will you give ledum when they come to you with pus? Okay, and when will you give ledum? When will you give SILICEA? Let it be punctured, let it be any damn thing. But when they are in the stage of pus, there we think of SILICEA. You getting my point? So there should be no scope for confusion. Okay? So moving ahead, overexertion, exams, okay? Dentition, though they have teeth which have come up, but don't worry. Overexertion, night watching, reading, okay? Night watching can be for different reasons. That's why boys are all excited. But you know, I'm talking of reading. You'll also see this ailment when we talk of mentals. SILICEA, they are great, they're highly intelligent people, and they're bookworms, very studious, learning, studying. We'll discuss. It's interesting. See, this, I don't know if the image is clear, but what I want to tell you there is foreign bodies. For example, here in this image, you see a small, stone, small stone, which has got in. Okay, ailments from foreign bodies, like you also see a small, this looks big, but a small thing. Like for example, many times, a small wooden piece and all will enter into our skin. Okay, fine. Ailments from foreign bodies, yeah. And what do you see here? What do you see? How do you interpret this image? You have a heater here, and what I want you to understand is, he's got foot sweat and he's trying to suppress it. Okay? Suppressed foot sweat. Ailments from suppressed foot sweat. Especially in SILICEA, they have cataract after suppressed foot sweat. Ailments from suppressed foot sweat. My time is over? No, okay. I thought this is a small indication. And ailments from sexual excess. Okay? And ailments from exposure to cold, damp weather, cold air, exposure to cold air, cold, damp weather. Okay? Exertion, mental exertion, studying, overstudying, night watching, okay? Injuries, strains, sprains, okay? Sexual excess, masturbation, loss of fluids. These are all the categories that you have in SILICEA. Okay? Any questions? Ailments from? Do you have anything to ask? Huh? Clear? Ailments from? We'll quickly see the physical appearance of SILICEA. How SILICEA looks physically. Okay? Now, they are the kids or they are the people who generally have large head. Head is large. Head is large, body is thin, but the abdomen will be pot-bellied. Distended abdomen, large head, and thin body. This is how they typically look. Which is the remedy which comes very close? Okay, lycopodium. See, lycopodium, probably your friend thought of lycopodium keeping the distension part in mind. Okay, other than lycopodium. See, lycopodium, the distension is more of gaseous distension. Okay, but this large head, very good. What is it? Calcarea fos. What is the simple difference between calcarea fos and SILICEA at this stage? Huh? Correct. How is it in calcarea fos? They generally have flat abdomen, flat chest, rhizotic features. Okay, you don't have the distended abdomen like what you have in SILICEA. Otherwise, calcarea fos also has a large head. And how is the neck in calcarea fos? Neck is thin. So thin that it cannot, not that it will fall, but it's thin, and head is large head. Thin extremities, they are tall for their age. Yeah, somebody was telling, eyelashes, yeah, all those things are fine. But flat abdomen. In SILICEA it is distended abdomen. Distended abdomen. Okay? So that's the physical appearance. And generally, they also have another common feature between calcarea fos and SILICEA is they have open fontanelle. Fontanelles don't fuse. Don't fuse in the sense they fuse late. Delayed closure of fontanelles in many remedies. Calcarea fos, you also have SILICEA. Calcarea carp, a lot of other remedies. Okay? So large head, any other remedies? Head is large. Which are all the other remedies in which you have large head? Think of some pathological conditions in which, see, when I use the word pathological conditions, you all came out with EPIS. You getting my point? Yes or no? Somebody was talking of EPIS. Now why head is large in EPIS? Why? Huh? Anasarca means everything should be swollen. No? Why? What is that pathological condition? Yeah, good. Edema. Where? Why edema? Huh? Hydrocephalus. What is hydrocephalus? Accumulation of fluid where? Ventricles. Okay? Fine? Okay? So, APIS can be a remedy for hydrocephalus. Calcarea fos is also there. When do you give calcarea fos in hydrocephalus? Is calcarea fos over? Yes? When do you give calcarea fos? Good. After menopause. What has got menopause to do with hydrocephalus? During pregnancy? Then who is pregnant, you give calcarea fos? Correct. During pregnancy, go ahead. What? There's something very interesting in calcarea fos, and I want you students to know. Hydrocephalus. I was fortunate to treat a mother. Okay? And she was 38, 39 years old lady, and she had this infertility problem. And what was the problem with this lady? We have the video of this case. What was the problem with this lady is not that she is becoming pregnant, not that she is delivering. She is becoming pregnant, she is delivering also. But unfortunately, the infant is not living long. 3rd month, 4th month, sometimes in utero, there is death of the fetus. And what is the cause for the death? The cause for the death is hydrocephalus. Artha aita? Infant is born, but with large head, infant has got hydrocephalus. Max 3 months. One child, the max lived for 6 months, and then the infant died. So almost 6 to 8 pregnancies have gone through like this. Okay? She becomes pregnant, either infant fetus is died in the uterus, or it is born, some happiness for the parents, 3 months, 6 months, the infant dies. And the cause for death is hydrocephalus. Can you take this clue? Can you take the clue? No, I mean, what is that you have in calcarea fos? And see, in calcarea fos, there is this beautiful symptom. And what is that symptom is? It is used as a preventive. It is used as a preventive in mothers who have already given birth to hydrocephalus children. That was the symptom we took. And I know it was again very challenging. 38 years, she becoming pregnant itself is a big challenge. And 5 years, they have left hopes. So we had to start from the scratch. She came for some other problem. But then, I disturbed her mind. I told, why don't you take another chance? Fine. And, we disturbed her. We called her husband. We also, tried to explain him, and fine, we thought we'll take a chance. So 38 years old lady, she became pregnant. Fine? Okay? Now the next problem is, she should not deliver a hydrocephalus child. That was the biggest challenge for us. So we had a small treaty. What was that? I'll give you some medicines. And now we have got beautiful technology. So we told, in utero only we can get to know if your child will have hydrocephalus or not. So we got a lot of investigations. Fine? So we said, we'll get all those scans done. If your child has in vitro hydrocephalus, whatever, we will terminate. Are you okay with this agreement? No, sir, we have done many times, 8 times. If you insist, it's okay, no problem. Husband was very cooperative. And we said, fine, we'll go ahead. So this was the biggest challenge. This lady was given calcarea phos. Okay? And we have the video of her 1-year-old daughter, beautiful daughter. Fine? Absolutely no signs of hydrocephalus. It's not fake. 8 deliveries. The mother has told in video, sir, we have had 8 kids with, she's a Kannada speaking lady with huge head and all, and they are all expert. Then I came to Dr. Vijaykrishna, and he has treated and see the result in front of you. Like, we have this beautiful girl, 1-year-old girl, very active, no problems. So I personally feel you should remember this case. And if I wouldn't have been a teacher, I wouldn't have got this opportunity to treat. Because calcarea phos, none of us think of calcarea phos for preventive. And Clark is the author who gives this particular phrase. Used as a preventive in a mother who has already delivered hydrocephalus children. Ange kortan. So we have, we have proved Clark right, giving calcarea phos. It was a lot of satisfaction. Fine. And such satisfactions you get only in homeopathy. You agree? Allopathy, fine. Anyway, today we have told so much about allopathy, so we'll not talk more about allopathy. But you got the physical appearance of calcarea, SILICEA, large head, fine, and pot-bellied abdomen. And minus pot-bellied abdomen, the other features looks similar to calcarea phos. We have some time. We'll take up the mind? Yes, just give me a minute time. SILICEA. Okay. Now I've shown you a few images. Quickly. Very good. They're shy, beautiful, good, timid. Any male voice is, it gives a lot of happiness. Timid, shy, yes. Okay. See now, what you see from all this, they're very shy natured, insecure kids. Okay. And so I discussed the meaning of the word timid. We have done this. What do you understand by timid? Timid. People with less courage. People with less courage. So SILICEA basically are very mild, very yielding. I don't know if you have some images. Okay, so very bashful. They shrink from public appearance. Okay, very shy natured. Okay, very timid creatures, timid constitutions. Now, how do you identify if this child is bashful in clinics practically? How do you identify quickly? Huh? How do you identify? See, it's a practical situation. Question I am trying to ask. In theory, we explain shy, timid, but what do we mean when we say shy and timid? Clinical ಹೆಂಗೆ identify ಮಾಡ್ತೀರಾ? Okay, I mean children, they hide behind mother. Huh? Okay, good. Then, huh? They don't talk to you. Okay, fine. Then, louder. Don't be shy. Don't be timid. Huh? Okay, chalo. So now what you see here is, see, another very important word that describes about SILICEA. I am predominantly talking about a SILICEA child, but generally they are very delicate people. They are very delicate kids. you'll have some image. Yeah, I mean, I don't know. Yeah, very delicate, very refined, very disciplined kids. Okay, and very sensitive. They'll not like anybody scolding them. Very mild. Okay, and very yielding. See, now this, what I have tried to show you here is, somebody would have asked him. From his face you can see, like, it is something that he likes. But somebody asks, they can't say no. They give. Okay? So they are yielding people. Fine? You say do that, they do. People who give up, people, the quality of conceding or submitting or surrendering is what we call it as yielding. So yielding, mild, very gentle, okay, and timid. See, now timidity, another very important thing you see in your clinics in future. When you question, okay, the child will go and whisper in mother's ear. Fine? SILICEA is the only remedy. Children who whisper into the mother's ears, or if they want to tell something, mother says, tell. No. He will go to the mother and he will whisper into mother's ears, and mother will tell on his behalf. Okay? They are more of SILICEA kids. Very shy, very timid, and refuses to answer. Instead, whispers into the mother's ears. SILICEA. And they will not allow you to examine. They will not come close to you. See, I have another PPT, but now we don't have time. How do we approach pediatric cases? Their behavior will tell you about the remedy. Fine? There are so many kids now, once they come, you take your mobile and keep it inside, or you safeguard. No, seriously, I'm not joking. I have done. And now we have realized. But what I'm trying to tell you is, doctor on guard, meaning you are so careful, you protect the laptop, you take it on your lap, or you hide it somewhere. Because this guy, when he comes, fine, he will take control of everything. Okay? Fine? Okay? I mean, that's how treating kids in homeopathy becomes fun. Not that, that they are very notorious, but it will tell you their nature. And SILICEA is exactly opposite. They will not talk to you. They are very shy natured. They go to the mother, they whisper. Fine? Very timid. Okay? Timid, and at the same time, very, very intelligent kids. Children are highly intelligent. Okay? Highly intelligent kids. And I would like to talk 2 or 3 points here related to their intelligence. They are very good at studies. That's what I tried to tell you when I told you about ailments. Ailments from reading, overstudying, fine, and whole night you see them studying. So what you have to realize here is, very intelligent, very studious, and kids who don't miss schools. Kids, I mean, see, again, why they don't miss school is also very important. Okay? And SILICEA, they don't miss school because they love. Illa kana. Alla illa kana. He is telling, 1 minute, please send. When a person is not there, how do I send? Okay, chalo, don't worry. See, what I was trying to tell you here is, see, now you are trying to tell some examples of your friend's name. With due respect to those names, what I am trying to tell you is, SILICEA will not miss school. Why a person will not miss school? Come quickly. Huh? What is it? No, see. One second. I know our class boys. I am limiting to school. I know what answers they will give. Okay. And they started discussing answers in those lines. But go back. We are talking of why they will not miss school. Good. See, yeah, absolutely right. For example, they might give you prize attendance. 100 marks, 100% attendance, you are called on the stage. You are called on the stage and you are given prize. Okay, good. That is not SILICEA. Huh? What could be the other reasons why a child? Yeah, one at a time. Yeah. See, one reason can be being studious. Good. Then other reasons. Fear of teachers. Fear of teachers scolding. Agreed? Huh? Jorak. Fear of parents. Why stay at home? My parents are notorious, so let me go to school. Oh, could be. They are afraid of parents. They are afraid of teachers. Then, crush on teachers. Okay. Chalo. Let's get back. See, that's the reason. That is the reason I told you. When you are answering, let there be some responsibility. We are talking of a child. Don't spoil his mind. Crush on girls, crush on teacher. Fine. Let us limit it to ourselves. Fine. Chala. What else? See, anyway, there could be a lot of reasons. But what I want to try to tell you is, in SILICEA, the reason is to learn. If I miss the classes. Okay? They are highly studious people. And very hard to get such kind of students, no? Yeah. Now you can name. Okay, chalo. Yeah, don't worry. Don't name your enemies or don't name your good friends. Chalo. We are not worried about the person, the name. But this is what you need to remember. Kids who are very conscientious, who are very diligent, some author says they are student for life, meaning they are always reading, studying. Fine? Okay? There are people, there are others also keep studying, but he is a very intelligent guy. He understands and he studies very well. Okay? So never miss school. Good boy image. What is this? Not this. Don't worry. Good boy image. What is this good boy image? Want to be in good books, like for example, teacher, good girl image, good boy image, carcinosin, ignitia, stephysagria, lycopodium. You also have SILICEA. Okay, very sensitive. They can be for smallest reasons. Okay, and see, not only we were talking of mild, but again another very important thing you also see in SILICEA is mild yet obstinate. What is this? Mild yet stubborn. Okay? They might listen to everybody, but ultimately they will do what they want. We had a very good friend, and he was in love with a girl. He is a homeopath. She is also a homeopath. But then they are from different communities. Okay? And lot of opposition from both the sides. But my friend was always very confident. And why was he confident is because his girlfriend was SILICEA. You understand? He used to tell me, Vijay, you don't worry. She will listen to her mother, she will listen to her aunt, she will listen to everybody. But ultimately, she is a very stubborn girl, she will marry me only. Because her constitution is SILICEA. Very mild, but they will do what they want to do. Fine? So when mother tells, don't marry that guy, okay mama, I will not marry. When auntie or uncle comes and tells, no, you should not marry him. Okay uncle, I will not marry. Fine? Ultimately, she married the same guy. Okay? So, very obstinate, very stubborn. This is what I wanted you to understand. No, don't worry. See, for everything, for every situation, you need not take names here. Okay? Now, this is what I was just trying to tell. Yeah, relax. Now, as I was just trying to tell, they enjoy learning, they are very good at studies, highly studious, okay? And the timidity, Yeah, relax, relax. The timidity to another extent. You also see that they have got lot of stage fear, anxiety, anticipation. What will happen? Okay. So stage fright, and another very important fear they have is fear of sharp objects. Okay. Fear of sharp objects. And one fear they have is pin mania. Pin mania. Fixed idea, you know, they got the strong fear of pins. They collect, they search, they collect, they count, and they keep it. Fine? I would again share a case. This is not my case. It's a case of my friend. He is a practitioner, very good practitioner. And there was this man with hernia. Okay? And you know, when he went to examine this particular patient, in South India we have this tradition of wearing dara on hakontalla urdara. Fine. So in that he was he had put so many pins around, and that was a clue for my friend. And when he asked why, no sir, I have got fear of anything sharp, and he generally collects and he puts it so it is safe here. And see, we have seen girls or women in South India, they have pins. Emergency, for some reason they keep pins. But here it was in a wrong area, and he had plenty of pins. And the reason he gave was like, I feel this is more safe, and he's got fear. He's got fear. So there my friend had taken this as, pin mania, and he had prescribed SILICEA for hernia. Fine? And with good results. So people who have a fear of sharp objects, especially pins, can be SILICEA. Okay? And exam fear. Yeah, very good. Beautiful point. They study well. Yeah, sir, we don't study well. We don't have fear. Why SILICEA fear? Whole night he is studying. No, that's a beautiful point. That is where SILICEA becomes different. They would have studied so well. In spite of that, they have that fear. Performance anxiety. Okay? Fine? So there, you can think of SILICEA. Anticipation, anxiety. It's also a remedy for night walking. It's also a remedy for night walking. We'll discuss. And there are people who have no confidence, who are low on confidence, very confused what to do, no confidence. Okay? And very, very fastidious, meticulous. Here you see a man who is measuring and is cutting. Okay? It should be very meticulous, very perfect. One of the perfectionist remedies. Yeah, fears, I told you, fear before undertaking any task, fear of pins, sharp objects, stage fear. A lot of remedies for stage fear, but this is also a remedy in which stage fear is very, very prominent. Okay, so quickly, mind of SILICEA. Quickly, shy, timid, bashful, mild yet obstinate. Mild yet obstinate. Okay, we discussed the fears. They not having confidence, and they whispering into mother's ears. Okay, they don't directly answer to you. These are few points. Okay, next class, whenever we get time, I'll try to take up the particulars, and we'll try to finish off SILICEA in next 1 hour. Okay, any questions from whatever we have taken up? Okay, chalo, thank you. We'll meet in the next class.